Hey everyone, come check out the awesome folks at Fowler Medical Group in today's featured partner series. Hope you all enjoy the interview. I'm here today with Dr. Ryan Fowler of Fowler Medical Group, and we're just going to do a little featured partner series of one of the local doctors that I work closely with. So, Ryan, just kick it off. Tell us a little bit about your practice.
Yeah, so my practice is called Fowler Medical Group. We are in our 7th year here in the Temple Belton community, and we love helping out the community. We love taking care of people and helping people feel better is really what we're trying to do. So.
Yeah. So I know a lot about your practice. Everyone else may not. It's a little bit unique. Can you describe what that's like?
Yeah. So we're a membership-based practice. So we don't take any insurance. But because of that, we're able to spend time with people and teach them how to be healthier and really help them a lot more and kind of dig into their health problems. And so it's based on a monthly membership that's very affordable, and it's age-based, and we take care of all ages here and do all the typical primary care, but we also kind of work really to optimize people and their health. So.
Okay. So, like, I guess if I was somebody and I had, maybe high blood pressure or diabetes, how would that be different working at your practice than what would be like a conventional insurance practice?
Well, in the conventional practice, you might have, a 15-minute appointment of which you might actually get 7 or 8 minutes talking with the doctor. With our practice, your first visit will be an hour, and your follow-up visits are at least 30 minutes or longer if we need. And because of that, we're able to talk about things beside prescriptions that may help your problem. For instance, with blood pressure, we could talk about diet and exercise and sleep, screening you for sleep apnea, all these things that might help you improve your blood pressure without putting you on a prescription medicine.
Yeah, that sounds like medicine that's supposed to be how it's supposed to be done, right?
That's how it used to be done.
Yeah.
So we're trying to bring back the old and do it like they used to do.
That's awesome. That's awesome. Kind of like speaking along those lines, I guess. I know you said it's membership based, but when it comes to additional things like labs and testings and imaging, how does that work with y'all?
Well, we've kind of cemented relationships, really around the Temple Belton, Waco, and kind of northern Austin area where we can help you get the most affordable things, whether it be labs or imaging or surgery or specialist care. And so we have a lot of relationships in a way to make those happen on a cash basis, and typically that's going to be cheaper than with insurance. So if you pay for your labs with insurance, what they'll do is they'll take the cost and they'll triple or 5 times the cost and charge you that. And the insurance may not pay all of that, but they'll pay some portion of that, and then you might be left with whatever is left over.
Okay.
So doing things that way, we're able to help people get things very affordably and often save a lot of money on their health care.
Yeah, and I imagine maybe even skipping the paperwork process where you have to wait weeks and weeks and weeks to get something done.
Yeah, the classic, and you probably run across this, is I have this orthopedic injury or problem, and you put your insurance in to get an MRI, and they say, no, you haven't done physical therapy, or you haven't done this, or you haven't done that. And if you bypass that system, you can get it whenever you want, and you can get it cheaper.
Yeah, that's awesome. Yeah, that's awesome. Oh, well, speaking of orthopedic injuries, I know that you have a specialty in sports medicine, right? So tell us a little bit about how you're focused with not only just normal conditions that people see a doctor for, but also those sports medicine conditions.
Yes, I'm a board certified family physician, and I'm board certified in sports medicine, which is kind of a bad term, but it's basically non-surgical orthopedics.
Okay.
With some other stuff added in, like, for instance, concussions and exercise prescriptions and nutrition and some additional things like that. But I love the sports medicine aspect, and what I've kind of landed on is really trying to help people get better. And the way that I do that is through regenerative injections.
Okay.
And so we use prolotherapy, platelet-rich plasma, and bone marrow aspirations with stem cells to inject with whatever injury or problem you have in the orthopedic sense to help them get better. And often their pain will get better and their function will get better, and they can have these improvements last for years to come.
Yeah. I know a lot of my patients that sometimes I get those questions about those regenerative injections, but they don't necessarily quite understand necessarily what they are or how they work, so to speak. What would be the best way to describe how each, like prolotherapy, PRP, and stem cell, how do those become so effective for your patients?
Yeah, so prolotherapy has been done the longest, maybe in the 70, 80 year range. And it's basically, at least now, basically using dextrose, which is a sugar, to inject around joints. And they found through multiple studies that it actually helps the ligaments and tendons strengthen themselves.
Okay.
So they're actually improving the structure through these injections. And with strengthening them, often the joint gets tighter and more stable, and it helps with a lot of symptoms. So that was what it was all based on. And then they found through using parts of your own body, like the healing parts in your blood. So platelet-rich plasma is drawing blood, and then spinning down the red blood cells and taking that out, and taking the healing factors and the healing cells and all the amazing stuff that's found in your own body, and injecting that into similar parts that would help improve pain and improve function, basically. And the kind of top level of things that we do here in the United States anyway is bone marrow aspiration, and that will get you all those same healing factors and healing cells, but also stem cells. And a stem cell is basically a cell that can become other things.
Okay.
So if you're injecting it into an orthopedic problem, it could become another cell to help in the healing process. It also sends a lot of chemical messengers that bring all the healing things that your body does anyway into probably a chronic thing that hasn't healed. And by stimulating that, you can get improvement in pain and function, like we talked about.
Okay, that's awesome.
Yeah.
I lost my train of thought. There was a question I had when it came to the oh yes, with the prolotherapy. I've heard that it's important to find the right provider when it comes to these injections, because there's different methods in the preparation process. Is that true? Or like how is it different?
Yeah, so I'm not the only person in Temple Belton who's doing these kind of treatments, but there's several things that set me apart from others. For instance, I'm a medical doctor, and when you look at the training of other professionals, the hour range, there's a vast difference. So like, if you compare the 10,000 hours, or I don't even know what it is for me now at this point, because I'm 20 years in, versus basic 10,000 hours that go into maybe being a doctor at year one versus physician assistant or nurse practitioner. It's a very big difference in the training. So that's the first. Is I'm a medical doctor, so I've gone through many thousands of hours of training just to be to where I am. But then I also did specialty training in sports medicine, which is a lot of ultrasound training, injection training, physical exam training, a lot of the things that go into that. So I'm a specialized orthopedic injection doctor, basically.
Okay.
So that's one part that would be different between me and some other people that you might see doing this treatment. The second part would be the preparation in the cells or the biologic treatments that we're using. So I work with a company called Regenex, and they were the originators of stem cell treatment in the United States, and have been doing it 20 plus years, and they've honed that process to be what I would consider the world's best. At one point, and it may still be true, Regenex physicians as a whole held about 40 to 50% of the literature in the scientific literature on regenerative orthopedic injections. That tells you their level of expertise. So with that process, we have a flexible lab, so I can dial up or down the platelets and different healing factors, and in general get way more platelets and healing factors than other places around town would be. Most of these places are using kits where you put the blood in or the bone marrow in, and it spits out one thing, and often not nearly as many platelets and healing factors as I can through my lab. A third thing that kind of goes along with the first is my training, but all of our injections are done using ultrasound or imaging guidance, basically. And so if it's blindly injected into a joint or structure, often, even though you think you're hitting the right spot, often up to 50% you're not. you're going to miss the structure. So you're paying all this money to get this specialized thing injected somewhere, but if it's done blindly, the chances of it getting there are almost the flip of a coin.
Yeah.
So those would be the three, I'd say, big differences between what I do versus others.
Yeah. I forgot about that, but I did remember that some things that some of the top experts say, kind of like yourself, it's so important to have it be imaging guided.
Yeah.
Like if it's not imaging guided, it's probably what's throwing off some of the studies, I imagine.
Yeah, I'd say some of the studies, I mean, what I would see is they're using different methods to generate whatever product they're injecting, and so apples and oranges aren't necessarily the same. So if you're using this kit versus a different way, it's going to give you a whole different substance to inject, and you might not be getting enough platelets or enough of the healing factors to inject. And then obviously if you're not injecting with guidance, your chances of getting there are, like I said, a flip of the coin.
Yeah. And so the mechanics of it all are the one thing. I've had the benefit of working with some of your patients who've had this treatment, but what would you say have been the typical outcomes for a patient? Say I hurt my knee lifting or practicing jiu-jitsu and come in to see you and want to get better as quick as I can. What are my outcomes looking like?
I think in general I have very good outcomes. I think the one thing people have to realize is with the procedure that I use, you are not going to have the typical downtime that you would with surgery, and you're also not going to have the risks of something bad happening. So you do forego that. But I think what people have a little bit of a hard time grasping is that the improvements take a while. They do take months after an injection to really get all the way there. You can sometimes see improvements in as much as 4 to 6 weeks, but really it could be even 6 months out before you're seeing the max. Because what we're working on, the soft tissue structures in our body, to rebuild that and to heal those things and the collagen and all the things that go into it is like a 200 and some day procedure. So it takes a while for this to get better. But I would say in general, we're getting really great results frankly in things that shouldn't improve. Like someone with really bad arthritis and they're seeing improvement at all with something like this is amazing, I would say.
Yeah, I mean, I even remember reading a study back that showed that there was some evidence showing that these types of treatments can actually regrow cartilage, which was something that's pretty much unheard of. At least, these people like yourself who've been doing it, probably like, yeah, we've known this for the last 20 years, but definitely from the physical therapy aspect, like we can calm down those structures, but expecting cartilage just to regrow is kind of unheard of.
Yeah, I think the medical system is coming around more to these types of injections. I mean, when you look at like the generalized orthopedic guidelines, I think PRP is like really the main non-surgical treatment at this point.
Yeah.
Even in conventional areas, but again, kind of how they're doing it versus me, there is a big difference. And I think there are other things at play in how people get better, like nutrition, changing lifestyle. You have to optimize their strength and mobility through physical therapy. So that's always a part of the treatment plan for something like this. So,
yeah, that's awesome. Well, I guess to wrap things up, what would you say if somebody didn't know about you and wanted to learn more? I guess how do they get connected to you? Are there any specials of it that you're running, or I guess what's the best way to get started?
Well, my website probably is the easiest place to start. It will kind of run you through all the services that we do, and you can get some information on there. And then I know specific to the regenerative injections, there are a lot of hyperlinks which will take you to the Regenex site, which has so much information. If you're interested, you could even go on the Regenex site and pick whatever joint it is we're treating, and because they've done this for so long and they're tracking these procedures, you can see what the average improvement is and over how many years, how long that lasts. So we'll talk about, in general, knees improve in the 60 to 80% range, and that can last for up to 5 years. Anyway, you can get a lot of information there on the internet. You're welcome to call or text my main number, and we can get in touch with someone here directly. You can come in and meet with me, and we can talk about your specific problem and how we might be able to help you. I'd say those would be the easiest ways to get in touch with me right now.
Cool. And I'll make sure to link Dr. Fowler's information on the video. You'll be able to get to his website, have a phone number, check out their social media. But they are an awesome practice, really changing the game with how medicine should be practiced. If you haven't worked with somebody like this before, you do deserve a chance to give them a call and experience the difference. Thanks, guys.
Thank you. Thanks, Brett. And I think you're doing the same. The way you're doing your practice is kind of the same way you're allowing people time with you directly versus in the regular world, it's not. You might be seeing the assistant versus the physical therapist.
Yeah.
That's a big difference. So, I appreciate you and what you do, and you definitely help a lot of my patients. So thank you.
Appreciate it. Thanks, guys.
So